Hello, everyone. My name is Dr. Ajay. I'm a naturopathic doctor practicing in Mississauga, Ontario, Canada. I have chosen to do my capstone project on pillar number one of the Biden-Harris administration's national strategy on hunger, nutrition, and health. For those who are unaware, pillar number one of the initiative refers to finding ways to help more individuals who are experiencing food insecurity benefit from federal assistance programs. Let's give a brief definition of what food insecurity is. Food insecurity is when the food intake of one or more household members is reduced and eating patterns are disrupted at times during the year because the household lacks money and other resources for food. When doing my research, the most recent stats that I could find were from 2022. According to the USDA, in 2022, 44.2 million people lived in food insecure households in the US. Out of this number, 7.3 million were children. I'm sure that everyone is familiar with this picture of the healthy eating plate. Our ideal recommendation for a healthy diet is to have a meal that has a majority of vegetables, then protein, whole grains, and a variety of fruit. I think that we can all agree that this would be the ideal recommendation for most of our patients, and that if they were able to follow such a diet, they would be on their way to achieving optimal health. The reality is that not everyone has the financial means to eat as healthy as we would like. According to the American Journal of Clinical Nutrition, it was found that grains and sugars were cheaper than fruits and vegetables per serving. Also, that with the high fixed cost of selling fruits and vegetables at the retail level, they tended to cost 40% more than unhealthy alternatives. So if someone wants to maximize their grocery bill to feed their family, it tends to be more affordable to purchase unhealthy options compared to fruits and vegetables. Luckily in America, to help with the affordability issue, is the USDA's Supplemental Nutrition Assistance Program, or SNAP for short, which provides food benefits for low-income families to supplement their grocery budget. I believe that this is a very good program, but obviously there is a maximum amount available to individuals per month, which they have to budget for when shopping. This can once again influence the decision-making process of what they are choosing to buy. Let us switch our attention to another problem in America: food waste. According to refed.org, in 2022, 77.6 million tons of food waste was generated. That was $473 billion lost overall. Of that food waste, 26.5 million tons of produce, fruits, and vegetables was lost. In terms of dollars, it was around $64.8 billion. That's quite a bit of money if you ask me. This slide shows some of the ways that food was wasted at a retail level. It ranges from damaged packaging to discarding blemished or misshapen foods that weren't appealing for consumers to purchase. According to a research paper written by Gene Busby, Holden Wells, and Jeffrey Hyman, it was found that we lost over $31.2 billion due to food waste at the retail level in 2022. This doesn't add up. We had 115.8 million people living in food insecure households in 2022 who couldn't afford fruits and vegetables, yet we wasted 4.4 billion pounds of fresh fruits and 5.2 billion pounds of fresh vegetables that year. We need to find a solution to this. One suggestion to help this issue is the retail juicing of misfit fruits and vegetables. Misfit fruits and vegetables are those which may be damaged, misshapen, blemished, or otherwise unappealing to be bought by a consumer. Grocery stores may be sorting out these products and either discard or hopefully repurposing them. The plan involves creating a misfit juice bar idea. Every morning, misfit produce are prepped up for consumers to choose from so they can have made fresh custom juices or smoothies. The variety of fruits and vegetables varies from day to day depending on what misfit produce are available at the store. In terms of implementing this idea, it would be quite simple. Many grocery stores already have food prep areas where they make meals for sale, such as salads, fruit trays, etc. They can invest in a blender and pay for reusable bottles, which have their logo on them. These bottles can be brought back to the store to be washed and reused for more juices in future visits. One way of making these nutritious drinks available to everyone is that they can be SNAP eligible. According to SNAP, cold drinks, including smoothies or similar items, are eligible for SNAP purchase if they are intended for home consumption. If the store is providing options of 500 milliliters or 1 liter containers, then these can be easily taken home for later use. Retailers can have a system in place where they can charge a discounted price for the smoothies for SNAP users and charge full price for non-SNAP users. This way, SNAP users will be using less SNAP dollars towards the purchase of these healthy smoothies and have more to spend on other items. The advantage to SNAP consumers is that they will have more accessibility to fresh fruits and vegetables for themselves and their families that is cost effective. The SNAP discount will act as an incentive for them to want to include fresh smoothies into their grocery carts. This idea may become appealing to retailers so they can recoup some of the losses from damaged fruits and vegetables. Along with decreasing food waste, they can use the bottles as a form of advertising if they place their logos on them. Consumers would come back to the store and return and reuse these bottles for more juices. In summary, I believe that this action plan will help with the reduction of food waste, along with increasing accessibility and affordability of fruits and vegetables to food insecure families, and act as a way for retailers to recoup some of their financial losses due to food waste. Hy-Vee and Meijer are popular grocery store chains in the US that have also made commitments to this White House initiative and could potentially become partners in trying out the ideas outlined in this Capstone project. I had reached out to both of these grocery stores and unfortunately had not heard back. Perhaps if any fellows have connections with either of these organizations, they may both be able to suggest some of these ideas. Here's a list of references for the information that was used in this presentation. I have included my email address on this slide should you wish to reach out to me with any questions or comments. Thank you for watching my presentation.